Lumbar spine rotational mobilization, grade 4, targeting segments 4 and 5. Patient sideline, hips and knees slightly flexed. Therapist palpates the interspinous space between L4 and L5. The therapist puts both of the patient's knees into the groin area and flexes the hips and the knees simultaneously until interspinous motion is felt in between segment 4 and 5. At this point, the patient straightens the bottom knee and the therapist hooks the top foot in the popliteal space of the bottom knee. The patient raises their head so the therapist can grab and support the upper body, slightly flexing the upper body until flexion is felt on the L4 interspinous space, and slight rotation is added to that segment. Once in this position, the therapist can step away, and the patient's in a very comfortable position. The therapist will log roll the patient 10 to 20 degrees toward them. The therapist brings the top arm underneath the patient's arm and puts the thumb on the top of the spinous process of the L4 and the other index finger on the bottom side of the spinous process of L5. The stabilizing hand is the right hand and doesn't move. The rotation force comes from the therapist's forearm on the patient's hip in a rotary type fashion. Oscillations are small and direct, specific to the joint. This mobilization can be done with the knee flexed, or it can be done with the knee extended, putting the sciatic and tibial neural structures on greater stretch.